Good morning, everybody. The topic for today's presentation is Puradigm Zone, an alternative way to reduce healthcare-associated infections in traumatic brain injury patients, a case study. So before I introduce myself, I would like to present this no conflict of interest slide. It's just my volunteering with this case, and there's no conflict of interest in whatsoever means. So my name is Leela Paladugu. I graduated from Siddhartha Medical College in India, and after that I moved to Trinidad, one of the Caribbean islands, where I practiced as a pulmonology and critical care medicine specialist for about 8-9 years. And 5 years back, I moved to Saginaw to matriculate into Central Michigan University's PhD program. So right now, I'm there, a student there, a PhD doctoral student in neuroscience. So before I start my presentation, this is a slide which basically explains it's kind of what to expect today. Because this is a case study, I thought let me just write down a little abstract, give introduction about traumatic brain injury Puradigm Zone, actually go into the case presentation, how the case was managed and what was the outcome, further discussion and conclusion slides, and then my final slides would be references and acknowledgements. So, abstract. The purpose of this case study is to evaluate the effectiveness of Puradigm Zone in reducing healthcare associated infections in chronic traumatic brain injury patients in a long-term care setting, rehab setting, nursing home setting, etc. The methods included the use of this device in a room of a chronic TBI patient in a rehabilitation facility, which is the healing center of Insight here. A little background about TBI. It remains a challenging and a complicated disease process to take care for. But in spite of the advanced technology and the guided treatment too, it's still a complicated, challenging disease. So the mainstay of treatment is focusing on reducing the secondary injuries with the help of multi-specialities in a critical care setting. That's where all the PTs, OTs, and speech and language therapy, everybody come in place. So prognosis is even more challenging than the treatment itself. Though long-term outcomes follow TBI, they correlate with the severity of the head injury and other acute factors that happen during the process of that head injury. The role of healthcare-associated infections, they cannot be ruled out as an important predictor for the poor outcome of patients surviving TBI. So the use of Puradigm Zone in survivors of TBI, it would be effective in reducing multiple hospital admissions due to HAI, therefore reducing the mortality and morbidity. So that's kind of our hypothesis for this case study in these patients. So introduction, many of you might have known about TBI because I know you guys deal a lot with those patients here. But still, I thought let me just put a little introduction, one slide. So there are about 1.5 million TBI cases every year, and there's a leading cause of death among the individuals younger than 45 years of age. So as it's written there, about 50,000 of deaths are caused by TBI injuries, and about 80 to 90,000 of them survive with debilitating head injuries. In many cases, patients are left with inability to work, and they also cannot perform activities of daily living, simple activities. So it can be classified mainly into primary and secondary injuries, diffuse or focal injuries. And the severity of TBI, it can be measured through three processes: Glasgow Coma Scale measurement at the scene, duration of loss of consciousness, and post-traumatic amnesia. So complications of TBI include post-traumatic seizures, hydrocephalus, DVTs, spasticity, GI and GU complications. But I kind of highlighted healthcare-associated infections here because that's our main focus in this topic today. Long-term physical, cognitive, and behavioral impairments. So those are also the factors that commonly limit the patient's ability to reintegrate into the community and also to return to employment. So these include the cognitive factors. All these include insomnia, cognitive decline, post-traumatic headaches, and depression. So common tools to measure the outcomes are functional independence measure, Glasgow outcome scale, and disability rating scale. I did a lot of literature search because connecting the TBI patients with the Puradigm Zone and reducing the hospital-associated infections, it was kind of difficult. So I had to go through a lot of literature. There was no direct connection the literature mentioned, but I could pick up some of the papers. These are my some of the papers which I searched about. Um, what I got the information about from these papers is that overall 4% of hospitalized patients develop at least one healthcare associated infection. And the economic burden, it would rise approximately to $10 billion. So this healthcare associated infections, if it has to treat like 650,000 patients, imagine the number of patients who are repeatedly being admitted to the hospital for those infections, and the length of the hospital stay is more, and how they have to be taken care of later. So that's where the economic burden comes up. uh, Healthcare associated infections, it's a broad term wherein hospital acquired pneumonia, ventilation related events, surgical site infections, other nosocomial infections, UTIs, uh, infections on the ulcers, etc., they all come under that umbrella of healthcare associated infections. And the risk of transmission of multi-drug resistant organisms, MDROs, they are high, and they are associated with patient-to-patient transmission with the prior room occupancy. Because if this patient has MDRO and then the patient is discharged, now we are putting another patient in the same room, still the organism is there, surviving in there, even with the amount of fumigation you do or the amount of sanitization you do, they are still there. That tough those organisms are. They survive in those environments for weeks. So it's very important for us to get rid of those organisms before we really put the next patient back in to avoid these infections. So using no-touch disinfection technologies like ultraviolet rays, hydrogen peroxide vapor, they can limit the transmission of nosocomial pathogens and prevent HAIs to some extent. But even though there are a lot of studies which showed the efficacy of UV light and HPV, HPV in significantly reducing the C. diff infections, vancomycin resistant enterococci, there are certain limitations of these devices wherein they are they say that they cannot cover the whole room, especially in the corners where the bugs tend to concentrate, and they are not very mobile, like they're not portable enough for to go everywhere. So those are certain limitations, and the cost effectiveness also, they're very costly. So eventually I was reading one paper and they said, with respect to cost, it's better to hand wash properly and clean. The regular sanitization works out better with respect to cost than the UV light and the HPV systems. So therefore, in order to overcome these limitations, there's this one device called Puradigm Zone, which can be tested. So what is Puradigm Zone? This is a photocatalytic reactor that emits reactive oxygen species produced by reducing the oxygen as the air flows through the apparatus. So there are special filters in there, and as the air circulates through the device, the reactive oxygen species are emitted. Normally, the reactive oxygen species in the host, what they do is they are kind of host defense mechanism. So they have this antimicrobial activity and they kill the variety of pathogens in our body. So the same application is with the Puradyme Zone apparatus. So it's basically emitting those energy particles which are reactive oxygen species. So they are responsible for disinfecting the whole room. So that's the idea of using Puradyme Zone. This can be the limitations of UV light and HPVs, as I said before, they can be overcome with this use of this device. So studies have also been done on human subjects in occupied spaces, and it's totally safe on human subjects, and it's portable, and its ability to carry with the patient is a main advantage of this device. So testing also indicated that it's effective against Clostridium difficile, which is a spore-forming bacteria than the traditional cleaning methods. So once a patient is having C. diff infection while in hospital, so there are um, certain ways to get rid of those C. diff bacteria before they put the another patient inside there. So those are the cleaning methods, like they have to do with Clorox this time, this is the contact time and all that stuff. So that one is surpassed by Puradigm Zone. That's what studies tested say. So due to these advantages, Insight wanted to study a case by introducing this device to a patient with severe TBI and hypothesizing that it would reduce the healthcare associated infections in this patient, and therefore increasing the life expectancy and his quality of life. I do have here a video just explaining how Puradigm Zone actually works.
Is it connected to something on the back side?
No, it's just a YouTube link, but it worked for me at home.
Same media not
Oh. Media not found. So,
you want me to go to YouTube and pull it up?
I'll do that in the end.
Yeah.
Yeah. I'll just pull up this in the end then. So we go to the case presentation now. So MDF Jr. is a 29-year-old male currently residing at Insight Healing Center. He was involved in motor vehicle accident in August 2016 and was admitted to Hurley Medical Center for severe traumatic brain injury with a bilateral subdural hematoma and T3 spinal injury. I should say here, as I'm volunteering for this case, due to some HIPAA regulations and all that stuff, I cannot access the medical records of this patient. So whatever records I have with me, I try to pull up those and I try to condense that. And I came up with this case, an overall view, but as I go forward, maybe I can go into more details later. But at this point of time, this is what information I have. So the signs and symptoms on presentation, his GCS was very low. It was 3. There was loss of consciousness for about more than 24 hours. And there was post-traumatic amnesia, quadriplegia, hypovolemia. He had seizures and he was in acute respiratory distress. Physical examination during the hospital stay, patient was intubated and he was not in respiratory distress. He opened eyes slightly to painful stimulus and pupil was 3 millimeters round and reactive bilaterally. So initial investigations, all the basic investigations were done. CBC showed anemia, leukocytosis, and basic metabolic panel showed hypernatremia. I just put the positive results here, which were just to discuss. And the initial chest X-ray showed right pneumothorax. CT head initial showed subdural hematoma with a midline shift, and a follow-up CT status post craniotomy, it showed improving pneumocephalus. There was no hydrocephalus or midline shift. While during his hospital stay, he contacted HCAP, healthcare associated pneumonia, UTI, and had uncontrolled seizures during his hospital stay. After an extended stay at Hurley Medical Center, patient was discharged to select specialty. So the working diagnosis was blunt trauma to the abdomen, right pneumothorax, subdural hematoma and right depressed skull fracture, fracture of T3 vertebra, fracture of left tibia and fibula with degloving of left foot, right pleural effusion, right lung empyema, acute respiratory failure, coma and quadriplegia, hyponatremia, polyuria, right hip dislocation and left ulnar fracture. There are a few more to put in here, but I thought these were the main issues the patient was suffering with. A discharge diagnosis was severe TBI with subdural hematoma, so bilateral craniectomy was done, quadriplegia, an unstable T3 fracture and spinal cord injury. Laminectomy was done for that, corpectomy and fusion of vertebra C5 to T7 was done. And fracture of the left tibia and fibula was taken care of. For degloving, they did a below knee amputation. Patient was having pyrexia of unknown origin and he contacted ventilator-associated pneumonia. The bug is Pseudomonas, which is a typical hospital nosocomial infection. He was in persistent vegetative state, and for his respiratory failure, he was on mechanical ventilation, but then eventually a tracheostomy was done for him. So major issues for the patient were persistent fevers, recurrent seizures, and frequent hospital admissions for chest infections, UTI, fevers, and status epilepticus. I just put a timeline of what happened exactly. So everything started in 2016 August. So there were multiple admissions. These were all the multiple admissions. They were more in 2017, kind of around the same in 2016 they were more. And 2017 he was admitted, but most of these admissions were due to status epilepticus. Around March 2017, early 2017, the device was installed in the patient's room. Puradigm Zone was installed in patient's room. So yes, he had infections. Yes, he had recurrent hospital admissions ever since the device was installed. But say if I did have an encounter with the mother of the patient once, and what she said was, say if he had like 7 admissions in 2016 due to pneumonias or UTIs, after installing this device, she said maybe the admissions came down to 2 or 3 in the year because of those infections. But he had admissions, those were mostly due to convulsions, seizures. So, immediate treatment, I mentioned this before during the working diagnosis and discharge diagnosis. So, the follow up treatment for this patient was he was discharged to a long term acute care facility with the multidisciplinary treatment approaches, which included the interventions from a physiatrist, a physical therapist, occupational therapist, speech and language therapist, neuropsychologist, rehabilitation nurse specialist, along with social work input. Eventually, the patient was transferred to Healing Center at Insight for continuing of care, and a Puradyme Zone device was installed in the patient's room early 2017. When I first had this encounter with the mother, like a month ago, the opening statement she said was, she knew that we were coming to talk to her about the device and about his condition. So the opening statement she had was, "This saved my son's life." And that practically told me, like, it gave me a broad view of what was happening there, how what happened before, and how connected they were to this instrument, and they carry it everywhere they go. And now with hospital admissions too, they carry it with them, they leave it in the hospital room at any for any length of time. So, according to the mother, she said he showed significant improvement in social skills. He started to talk, write, and text messages too. Although he has difficulties with short-term memory, the new memories, but he definitely has. She notices the memory was intact from before the accident. So, because of the brain injury too, the damage in the parietal lobe and the temporal lobe would cause memory changes. So, which is normal for this patient. But there was a recent admission in June 2019 to Hurley Medical Center, and it was because of chest infection. She says they went for an ortho consult in Traverse City, and they had to stay there for 2 days, and they forgot to take their device, and they had to stay in the hotel. That's where he started to have chest congestion and started to cough, and he was eventually admitted to Hurley Medical Center for that. So this is basically the case study. So when we go to the discussion, what I found in this case is that there were reducing number of hospital associated infections, therefore reducing number of admissions, and there were improvement in patients' cognitive ability. Now I should say this didn't happen just because of Puradyme Zone. It started to happen with the efforts of physical therapist, occupational therapist, whatever cognitive uh, uh, improvement he showed. It started off with the efforts from the PT, OT, speech and language therapist. I would say Puradyme Zone is an additive, maybe effect, but the effect started to happen, everything improvement from these people, their combined effort. And this also improved the memory issues. What I'm trying to say here is because of reduction of these infections, the insult on the brain due to these infections, the inflammation that's happening inside the brain already because of traumatic brain injury, the insult has reduced. So his brain has been damaged already. And now because of these continuum of continuous infections, this inflammatory pathology and infectious pathology is further damaging his brain, therefore um, reducing his cognitive ability and so on. So I was looking at the literature. If something could help me support this finding, there was a Danish national cohort study done in 2015, which said hospital contacts for infections were associated with lower general cognitive scores in young age. Now, what this study was done is in normal people, because they were having these infections and they were continuously being admitted for whatever reasons, their cognition level was decreasing. Inflammation and immune components, which is a result of infections, they can directly affect certain neurotransmitters in the brain, which are considered to be central in cognition, which include the glutamine, serotonin, and dopamine. And it's not just the central inflammation. If there's any peripheral inflammation or which is due to a peripheral infection too, it can also indirectly affect these neurotransmitters through a pathway called kynurenic pathway. That's a tryptophan metabolism pathway. It doesn't need to really cross the blood-brain barrier. So many severe infections, they can be associated with some degree of sepsis affecting the brain, but not giving rise to encephalitis-like symptoms. It's just that the sepsis has effect on the brain too. So the cognitive ability, therefore, can be directly affected by infections or related immune responses. However, environmental factors and certain genetic factors also play an important role to influence these associations. The other thing is traumatic brain injury itself is found to initiate an inflammatory cascade. So there are certain level of inflammatory markers like interleukins, tumor necrosis factors. They are released uh, when there is a damage to the brain tissue or tissue damage. So identifying these molecules as early as possible through biomarker studies, through serum biomarker studies, or through PET imaging, it would help us to uh, reveal the patients who are more prone to nosocomial infections. Say if two patients are involved in traumatic brain injury and one patient has this high level of biomarkers of interleukins and tumor necrosis factor in his serum when they were measured within the initial 24 hours, this patient, we can say, is more prone to the hospital acquired infections in future during his length of stay in the hospital. So this study was done in University of Pittsburgh in 2016, where they say early and persistent changes in post-injury inflammation, they manifest in unique biomarker patterns. So the way the biomarkers have been increasing in the first initial 24 hours uh, predicts what patients can be infected with the hospital acquired bugs, what patients are prone to develop infections, and that way we can actually take care of those patients, be proactive in managing those patients. So that study, those people, they proposed that a combination of the traditional parameters of inflammation, such as not just measuring the white blood cell count, but it can be combined with measuring this serum biomarkers, inflammatory cascade biomarkers, within the first 24 hours to categorize the patients who are prone to nosocomial infections. So if we can go early and be proactive in managing these patients, therefore definitely the infections rate can come down. So here, what I would say is because of this inflammatory cascade, um, further going on further, we can somehow adapt these and manage with the patients we are having here at Insight or wherever, and we can check that too, replicate for replication. So there are certain limitations for this case study. First thing, whatever inflammatory damage that's happening with Puradigm Zone, reducing of the infections, everything was kind of, it had to be supported through medical evidence like any PET images or any of these biomarker study. The serum levels can be counted on. before and using the Puradigm Zone, what was the result before and what was the result later. So PET studies, positron emission tomography studies, they guide long-term therapy by helping establish a patient's prognosis. So in chronic management of head trauma, imaging has several different roles. So identifying post-operative neuropsychological sequelae, evaluating the underlying functional abnormalities, late complications of head trauma, and predicting the long-term prognosis. They also help us identify how the patient is performing cognitively too. So if there's any improvement in cognition. So imaging would help us, and biomarker studies also would help us. So if in this patient, if we could do a series of PET studies before and after, that would have given further support of our supportive evidence for our hypothesis too. Future directions. This is a good start for checking the effectiveness of Puradigm Zone in rehabilitation facilities. Now, since this is portable, this study can be replicable and it can be conducted at multi-centers, or in here at Inside we can do for more patients too. At this time, we can actually, as I said, we can overcome these limitations by doing some imaging studies before and after, comparing them before and after, so we can have more information, more supportive evidence for future studies to rely on. So in conclusion, in our study, we found that alternative no-touch disinfection would reduce the number of HAIs in survivors of severe traumatic brain injury, therefore reducing the number of hospital admissions, alleviating further inflammatory damage on the brain. Installation of PZ in a patient's room with severe TBI, again, it's the same thing in different words. It would negate further deterioration of the patient's condition with respect to both motor and cognitive functions. These are my references. And Insight, thank you so much for giving me this opportunity. Patient and his mother in the first place who gave the consent to actually study on them. And Dr. Abir here, she and we both went to CMU together. So we have been friends since 5 years. Yeah. So thank you so much, Abir, for the opportunity.
Surface purification technology for today's most challenging indoor environmental issues. All indoor environments face challenges from indoor contaminants that need to be addressed both on the surfaces we touch and in the air we breathe. Puradyme technology is designed to protect you in environments where other solutions cannot, at work, at home, and on the go. As air enters into the Puradyme system, airborne contaminants pass through an advanced pre-filter. To ensure maximum particulate reduction, the air then flows through a HEPA filter. Finally, the air then passes through our patented and proprietary Puradyme technology, which propels high-energy clusters into the environment. These high-energy clusters will work actively in the environment to reduce harmful contaminants in the air and on surfaces. Most of us spend up to 90% of our time indoors. We understand that outdoor air pollutants can be harmful, but we sometimes do not realize that indoor air pollutants can be even more dangerous. Modern buildings today have been designed for energy efficiency, and in so doing, we have sealed in harmful contaminants, such as mold, viruses, bacteria, and chemical off-gassing. Puradyme technology takes the solution to the problem by introducing some of nature's most powerful air and surface scrubbers into the environment. Puradyme's high-energy clusters proactively work to neutralize harmful pathogens and return them to a natural, harmless state. Our engineers and scientists have spent years studying and developing solutions that deliver safe and effective solutions for indoor environments. Applications for Puradyme technology include homes, offices, schools, restaurants, healthcare facilities, and athletic clubs. Any indoor space will benefit. Puradyme technology differs from other purification solutions in that our technology has been designed and engineered to do what other systems cannot, effectively address contaminants throughout the entire indoor space. Traditional filters and UV bulbs have been around for many, many years, but still fail to adequately address many of the challenges in our indoor environments. In this scenario, the surgical table is contaminated. HEPA filters and ultraviolet products will do nothing to address this issue, no matter how many units are in the room. Puradyme technology will attack the contaminants on the surface of the table. Puradyme technology is safe, scalable to any size space, and provides 24/7 protection throughout the indoor environment. Puradyme systems and technology are available to proactively tackle some of the world's most challenging indoor environmental challenges.